Good evening, I'm Dick Brennan.
And I'm Jessica Moore. Christine and Maurice are off tonight. In addition to the news that the virus has affected more than 50% of the U.S. population, the CDC says 75% of children have been infected.
This as cases are rising nationwide and in our area. The last month, the daily average positivity for New York City has gone up from 5.5% to just above 7%. And tonight, the White House is working to make it easier to get an antiviral pill. CBS 2's Jenna DeAngelis is here with details. Jenna.
Dick and Jessica, when Paxlovid was first approved in December, supply was limited, and until recently, it was hard to find. But with production up, the Biden administration is trying to make sure more people can get their hands on it.
We want to lower the severity of the disease that people get if they get infected, and we want to lower the hospitalizations. We want to lower deaths.
With that, the White House is working to expand access to Paxlovid. The COVID treatment pill has been shown to reduce COVID hospitalizations or death by about 90% if taken within the first 5 days of symptoms. It's already been authorized for high-risk patients as young as 12.
Over the last few months, the administration has worked very hard with Pfizer to increase the supply of Paxlovid,
launching an effort to double the number of sites that carry the free antiviral drug to 40,000 over the coming weeks, allowing pharmacies to order directly from the federal government to get doses to more Americans. Once Gabe Rice got his hands on it, he saw a difference.
So I definitely was feeling better, feeling less fatigued, coughing less congested.
Tonight, the White House announced Vice President Kamala Harris, who tested positive for COVID, was prescribed Paxlovid.
If there were ever a drug to ask your doctor for, Paxlovid would be that drug.
The push for the drug as cases across the country continue to climb, up 22% over the last week and 45% the last 2 weeks. Still, COVID deaths down over the same period, falling 13% over the last week and 37% the last 2 weeks. Dr. Daniel Varga with Hackensack Meridian Health says we're in a better place this time around.
The reality is because we've had variants that keep cropping up, there is some susceptibility. The good news is that both natural immunity and the vaccine seem to really lower the overall severity of disease.
And speaking of the vaccine, Pfizer submitted an application to the FDA for emergency use authorization of a booster for children 5 to 11 years old. Dick and Jessica.